Hello and welcome. Today we have Dr. Anneka Hutton, PGY2 at a reputed program in East Coast, and she is an international medical graduate. So we will be sharing her profile in a second with you guys. She's right there. If you like this interview, please follow her on Twitter. That's her LinkedIn profile. Follow her as well, and she's on Doximity too. Dr. Hutton, question for you is that we'll let you introduce yourself. Please go ahead and introduce yourself and talk about your journey after finishing medical school till you match into residency. Please go ahead.
My name's Anneka. I am a second year resident at a program on the East Coast. I guess Florida counts as an East Coast. I was a graduate of St. George's University. For St. George's University, the structure of this is that you spend 2 years on a beautiful island in the Caribbean. Can't really complain. It's nice weather, warm sandy beaches, and in between studying, it's not so bad to have that in the background. So 2 years there, and then you come to do clinicals in the United States. I chose to do mine in Brooklyn. My family's from New York, so for me it was a good way to get back home, and for me the food in New York can't be beat. So back in New York for clinicals. I was lucky enough to rotate through Brooklyn Methodist for my clinical rotations in my third year, which was a wonderful experience. Really nice mixed population, lots of different monetary backgrounds as well as ethnic backgrounds. And then for my fourth year, I primarily rotated at the Brooklyn Hospital Center in Brooklyn, and it's the same thing. You see a diverse group of people, different ethnic and monetary backgrounds, and I think it really taught me a lot about the finances involved in medicine. So it was a really great experience. In terms of what structure studying was like and how to prepare for my exams on the island, it was just books and questions. And then with regards to my clinical rotations, my experience was beautiful, but I didn't know what I wanted to do. I wasn't sure what my field would be, so I kept a pretty open mind with regards to every rotation that I went through. So my only advice to people going through that would be keep an open mind and pretend like you don't know what you're going to go into, because this way you'll take the most out of that experience. You'll be open, you'll learn as much as you can without having any preconceived notions. So then came USMLEs, and thankfully from St. George's University, you don't have to do any observerships since your second years are performed in the United States. It's a really good exposure to American medicine. I applied to residency in internal medicine. I finally figured out what I want to do, thank goodness. And I was successful in the match. And I know that's a lot of stress. And I know that a lot of medical students, fourth year can be so overwhelming and we experience so much anxiety. But it's going to be okay.
It's going to be okay. That is important part. So tell us a little bit about your observership experience, like how you picked up. Did you do any observership at all? And is there a magic number of observership and rotation you supposed to do during medical school or after medical school?
Yeah, so I did one observership, and I don't know what I was thinking, but I picked one of the toughest institutions in New Jersey to do an observership at. I was a fourth year. I was trying to juggle going on interviews with being at this observership and trying to make a good name for myself. And it was, for me, very bad timing. It was right in the heat of interview season. So I wouldn't recommend doing that. If you want to do an observership, it's tough timing with fourth year. I would try to schedule it as early as possible, and maybe you can even squeeze it in at the end of your third year. But that was my only observership, and I got worked. I learned a lot, but I definitely worked my butt off.
Okay. If you want to share that what worked for you during your USMLE exams, step 1, step 2, or CS, that's something you did it and that was a lifesaver for you, or this worked like magic, or something you realize that you're doing it really wrong, and then once you stop doing it, the life was totally different. So if you want to share 1 or 2 points there.
Yeah, so probably unlike most medical students, I am a complete perfectionist. So I don't know if anybody can relate to this in medicine, but for me, taking notes in medical school was something that I was so proud of. I was so proud of the beautiful, error-free, perfect text document that I would write. And you just don't have time for that when you're studying for the USMLE. And so I had to let go of that behavior. I had to let go of writing down everything, that fear of, oh, if I don't write it down, if I don't look at it later, I won't know it. You just have to trust your brain, trust that everything you're reading, you are absorbing. And as you keep going through, you will see the same material again. So for me, I used the UWorld Q banks, and they were a lifesaver. And there is so much repetition within that Q bank that if you make it through, and if you make it through 1.5 times, or if you make it through and only have time to look at some of the ones you got wrong, you will have seen the material that you need to know to do well on the exam. So rather than scribbling down every fact that you can, which was my pitfall, just breathe and read and keep reading and keep doing questions. And that worked for me very well after I got the hang of how to do the Q banks.
This is such a contrast because we did an interview with Dr. Kaur earlier a few days ago, and then she was a writer and she said she needs to write everything during USMLE as well. But I agree with you that you don't need to, as given that some of the U banks you will follow. There's so much repetition of those questions, and finally you'll get the concept and it get in there. So if you have not written it, don't worry about it. It'll come to you. So that's such a good message for both kind of learners who want to write it versus learner like you that who did not write it and then went through with it, because speed is something you want to cover your course and course material in certain time, and if it helps you to go faster, why not?
Yeah, and it certainly does help you go faster. And I know for people that trained in different countries, the blessing of multiple choice didn't always exist for you guys. I know there was some exams where you had to write in free text the answer, and that honestly makes me feel a little sweaty just even thinking about it. So for us, multiple choice. And as a second year, I think maybe even a first year medical student, I had a really great mentor in medical school, and he sat me down before a pre-exam panic, and something he said to me was so simple, that was, the answer is going to be in front of you. So just pick it. And the fact that I would see that piece of information and that I would know it and that I had been preparing, I think just trust your brain and the answer is in front of you.
Absolutely. I think that's a strong message. And for our viewers, please pay attention and then subscribe to our channel, because these quality interviews will be notified if you are a subscription for this channel. Okay, moving forward, next question is how you prepared yourself for interview trail. What special preparation you did, or something you practice, or what are the tips and tricks you can share with our viewers?
Yeah, so I people that previously, what questions did you get asked? What was the weirdest question you got asked? Someone told me something about their preferred lunch meat, and that, please don't ask me that question. I'm vegetarian. This is not going to go well. So, all these weird questions. I wrote down whatever anybody had been asked before, and I wrote down a little answer for it. I didn't write down in depth, prepare a speech so that when they asked me the question, I'm like, well, so funny that you should happen to ask me that, what I think about this. And then it was very rehearsed. And I think we should avoid being rehearsed like this. My recommendation would be have a general idea of how you feel about certain things. Check in with yourself before you go on the interview trail. What do you like? What don't you like? What are your strengths? You should know what they are, because you're trying to get a job. And what are your weaknesses and how can you make them a positive thing? Those things are very important. But also for me, I decided to breathe. It's such a terrifying experience. But before each interview, the night before, I would reread my little, what are my feelings about all these topics, and be prepared. But then I got the interview. So something about me they like. So I'm just going to be confident, quietly confident. Don't be too cocky, and just show up and be myself. And hopefully that's enough to get through.
Good point. Great point. I kind of jump ahead a little bit, but if I go back and talk about your personal statement strategy, and probably even before that, your letter recommendation, that ask of letter recommendation, if you can spend in 30 seconds on that, and then see what was your personal statement strategy for our viewers.
Yeah, so with regards to asking for letters of recommendation, they're important. They can't be understated, especially I think, there aren't going to be scores on the USMLE. I think letters are going to be really important for upcoming medical students as a way to set you apart. So really nurture those relationships with you, co-visit the residents that are ahead of you in training, nurture the relationships with the attendings, be inquisitive, show up on time, ask questions about cases, and